Hello Internet, and welcome to my very first ever YouTube video. I am going to be talking to you today about the 13 different chronic illnesses that I have, and I'm going to have just a brief overview about what some of them are and what they mean for me in my daily life. Please forgive me as I glance at my notes throughout this video. I am just simply not going to remember to talk about all I want to talk about if I don't have them. So the very first thing I want to talk about is my Ehlers-Danlos syndrome, otherwise known as EDS. And according to the Ehlers-Danlos Society, the Ehlers-Danlos syndromes are a group of connective tissue disorders that can be inherited and are varied both in how they affect the body and their genetic causes. For me, this causes like joint pain and dislocations and subluxations, and it's also like the root of a lot of my other medical problems. I also have the type 3 or hypermobility type of Ehlers-Danlos syndrome. The second thing that I have is POTS, or postural orthostatic tachycardia syndrome, and that is defined by the Cleveland Clinic as a condition that affects circulation or blood flow, and it's a form of orthostatic intolerance. The development of symptoms comes on when you stand up from a reclining position, and that may be relieved by sitting or lying back down. The primary symptom of an orthostatic intolerance is lightheadedness, fainting, and uncomfortable rapid increase of heartbeat. Again, that information is from the Cleveland Clinic. So in my daily life, this causes a lot of my really symptomatic days, really. This is, it causes, like it said, like really rapid heart rate or tachycardia. It also causes my blood pressure to drop really low. Sometimes low enough to make me pass out, often low enough to make me pass out. It also causes like heat intolerance, so what that really essentially means is that my POTS symptoms are exacerbated or worsened by the heat, which really sucks because I live here in the desert, so that's great. It also can cause like a lot of like chronic fatigue, so that's something to keep in mind for me in my daily life. It does make things a lot harder for me than it typically would for, I don't know what I'm saying. It just makes things a lot harder for me than it would, than things would be for a perfectly healthy person without POTS. So the third thing that I have is mast cell activation syndrome, otherwise known as MCAS. The American Academy of Allergy, Asthma, and Immunology states that mast cells are allergy cells responsible for immediate allergic reactions. They cause allergic symptoms releasing, excuse me, can't read my own handwriting, products called mediators stored inside them or made by them. MCAS is a condition in which the patient experiences repeated episodes of the symptoms of anaphylaxis, which are allergic symptoms such as hives, swelling, low blood pressure, difficulty breathing, and severe diarrhea. For me, it also causes my tongue to swell, and it can basically just cause me to have like sudden and pretty severe like allergic reactions, which they're not technically allergic reactions because they're mast cell reactions, but they're pretty much like symptomatically the same. I also do have allergies, so that's how I know they're like symptomatically the same for me. I have asthma, I've got reflux, and a plethora of like other GI symptoms that are kind of undiagnosed right now. I'm working on that. I've got auditory processing disorder, which is an interesting one. According to the apdfoundation.org, auditory processing disorder, or APD, is the reduced or impaired ability to discriminate, recognize, or comprehend complex sounds, such as those used in words, even though the person's hearing is normal. So really, even though I do have some mild congenital hearing loss as well, it just means that my brain has trouble interpreting what other people are saying. So it's not like a problem with my ears, it's a problem with my brain. I've also got non-alcoholic fatty liver disease, or NAFLD, N-A-F-L-D. The Mayo Clinic says that non-alcoholic fatty liver disease is an umbrella term for a range of liver conditions affecting people who drink little to no alcohol, such as myself. I don't really drink much. And it, as the name implies, it means that your liver's just basically storing too much fat. I mean, it kind of just takes after the rest of me. It's storing a little extra fat. It normally doesn't cause any symptoms, but for me it causes like some abdominal pain, which kind of sucks. Sorry, I'm just finding my place in my notes. I also have pelvic floor dysfunction, which is my absolute least favorite of all of the things that I have because it's so embarrassing and horrible. The American Society of Colon and Rectal Surgeons claims that pelvic floor dysfunction is a group of disorders that change the way people have bowel movements and sometimes causes pelvic pain. Basically, that's exactly what it does. I have a lot of pelvic pain. I have a lot of trouble going number 2, which is embarrassing and awful, but I want to put it out there in case someone else is going through it, and I want to make sure you know you're not alone. I think that's really all I kind of care to say about that today. But if you would like for me to make another video about it, I totally will. Just comment down below if you would like to know more about that. Or any of these other chronic illnesses, for that matter. I've also got occipital neuralgia, which is like it's what causes me to have like a lot of electric shock type headaches. It starts like in the back of my head right here, and they shoot over my head into my face, and it feels like I said, an electric shocking sensation. It really sucks. Johns Hopkins says that ON can occur as the result of a pinched nerve root in the neck. And how my nerve root got pinched in my neck was due to a syncopal episode, or like me fainting due to my POTS. So it's all kind of like interconnected, like my health, if you hadn't noticed that already. Don't know if there's anything else I want to say about that. I've also got depression and anxiety, which are numbers 11 and 12. Those ones are pretty well known. I don't know if I really need to go into much detail about that, but I definitely will be talking more about them in the future. I've got vocal cord dysfunction, or VCD. It's otherwise known as paradoxical vocal fold movement, or PVFM. And I'm going to turn my page. And that happens when the vocal cords or voice box doesn't open correctly. And I got that information from the American Academy of Allergy, Asthma, and Immunology. And how that affects me, it basically causes my voice to be really hoarse some of the time. So if you ever have trouble understanding me, I'm sorry. That's just how my voice is on occasion. It's not like that right now, thank goodness. It also has very similar symptoms to asthma, and it's sometimes hard to tell the difference for doctors, but even for me, like, it's that similar. So those are my 13 different chronic illnesses. If you have any questions about them, please do comment down below, because I would like to make a Q&A video about them all, and then maybe in the future I'll make individual videos about each one, going more in depth about my own experience with each. I'd also like to insert a disclaimer here saying that all that I've said is just is all according to my own research and my own experience. So please don't take what I'm saying as medical advice, because it's definitely not that. I also wanted to just say that if you have any other ideas for videos you'd like to see, please also comment that down below. Thank you so much for watching my video. This has been the very first Holistically Hannah video, and I look forward to making more content for you guys. I hope you have a great day.